Welcome back to my channel, Pattern of Good Works. My name is Donna, and today we will be in chapter number 6. Chapter number 6 starts on page 93. And remember, the book is called The Specialty Practice of Rehabilitation Nursing, a Core Curriculum, the 8th edition. So today we're looking at quality and safety performance measurement and accountability. As we look today on page number 93, it talks about performance measurement. So it starts out by saying performance measurement and accountability are essential for ensuring the delivery of high quality healthcare. Performance measurement focuses on measuring the quality and safety of care delivered by clinicians. It says accountability refers to public reporting of performance data and performance-based payments. It says reports by the Institute of Medicine, IOM, have documented quality gaps and the need to monitor quality by using standardized performance quality measures. So years ago, the IOM came out with a report in 1999 to say that to err is human. And what they found actually is that this landmark report says that about 44,000 to 98,000 people are dying annually from medical errors. So they wanted to quell this death by looking at why and what is really happening on a day-to-day basis with clinicians and their interactions with patients. They found that according to this book, the Centers for Medicare and Medicaid Services decided that it was necessary to implement post-acute care quality reporting programs with public reporting of the quality data. So in the event, for example, at a hospital, a patient dies while they're in the hospital receiving care, that should be reported, so that people should know that in the event that you go to this hospital, this was the occurrence or this was the event that happened. So CMS, and we know CMS to be Medicare Administration. CMS actually stands for Centers for Medicare and Medicaid Services. I want to get it right. It's a federal agency that administers major healthcare programs in the U.S. So it looks at giving, for Medicare, for example, gives health coverage to individuals who are 65 and older, as well as there are certain people, younger individuals with disabilities. That is also a subset of that Medicare program. They also manage coverage for low-income individuals and families, and the Children's Health Insurance Program, which is the CHIP program, is there. And they also help to develop regulations and policies like we're talking about to ensure quality and efficiency and healthcare services. So on page number 93, it goes on to talk about the three, or actually two of the three accrediting organizations. So we know, and most of us are very familiar with the Joint Commission. And the other organization specifically for rehab is called CARF, CARF International, and it's formerly known as the Commission on Accreditation of Rehabilitation Facilities. The third organization that looks at accrediting healthcare is called DMV, which stands for Det Norris Veritas. So on page number 94, it says, although many people receive high quality care, not all people receive high quality care with each interaction. So as we are going along as CRRN nurses, we want to ensure that our patients are getting high quality care with every interaction, as well as the organizations that we work with are focused on quality care. A little further on, it goes by saying care is based on continuous healing relationship. Care is customized according to the client's needs and values. The client is the source of control. Knowledge is shared and information flows freely. Decision making is always going to be evidence-based. Transparency is definitely necessary. needs are anticipated. That's huge for CRRNs. We're always anticipating the needs. We also want to quell waste. Waste is continuously decreased, and cooperation between clinicians is a priority. In 2006, the report Performance Measurement Accelerating Improvement, which was done by, again, the IOM, noted that the only way to know whether healthcare quality is improving is to document performance by using standardized measures of quality, and the report rewarding provider performance, aligning incentives in Medicare focused on how quality measures could be used for accountability purposes such as public reporting and performance-based payment. So quality measures, also called performance measures for quality indicators, quantify healthcare processes, outcomes, patients' perceptions, and organizational structure or systems that are associated with the ability to provide high quality healthcare or that relate to one or more quality goals for healthcare. So what does that mean in summary? So as we move forward, CMS, as well as other healthcare insurance agencies, are looking at the quality measures. And we talked about performance and poor outcomes and positive outcomes in our last video. So for if we're going to pay you, we have made a decision, CMS, we are saying that we are going to make a decision to no longer pay when there are poor outcomes. We will pay and incentivize you to make sure that you have more positive outcomes and that patients are feeling satisfied, as well as patients are getting the necessary treatments and they are not harmed while they're in the care of a hospital or another type of organization. I think this is the perfect place to insert a little information about CMS. So we went to the CMS website. So CMS has something called electronic clinical quality measures, which are ECQMs. ECQMs are measures specified in a standard electronic format that use data electronically extracted from electronic health records, that's our EHR, and or health information technology systems to measure the quality of healthcare provided. CMS is looking through these ECQMs to see how is our patient and patient and family engagement. It's looking at our patient safety. It's looking at care coordination. It's looking at population as well as public health. It's looking at the efficient use of healthcare resources. It's looking lastly at clinical process/effectiveness. These 6 things are under the lens or the scope of CMS. And why? CMS is saying healthcare providers, you are required to electronically report these ECQMs. And this is going to tell us how you are providing high quality and or if you're providing high quality care. You can tell me you're doing this, but I need to see it. I need to see your data. So they're looking at everyone's data. Whether you're in a freestanding hospital, they're looking at your data. Whether you're in a hospital unit, they're looking at your data. And each organization has an opportunity to stand on their information. And they're looking to see as well, are you using evidence-based medicine? They're also looking at the code sets and the measure logic. And CMS takes the time to update this every year to ensure that they're using current or evidence-based practice to do so. In conclusion, this week we looked at performance measurement and accountability and how essential they really are for patient quality as well as patient safety. We took a look back at the IOM and how IOM, through their report To Err is Human in 1999, established that we really need to rein in those medical errors that are causing death. We also looked at briefly the Joint Commission. We looked at CARF as well as DNV. We looked at their role in ensuring that patients are really safe. And we also know that through what we learned today, CMS has done many, many things to ensure that patients are receiving high quality care. And it starts really at just simple charting. Through the ECQMs, they're able to extract many different information that will translate eventually into dollars. So it's imperative as soon to be CRRN nurses that you ensure that you're delivering quality care each and every time that you interact with your patients. I want to encourage you to continue to fight that good fight of faith and to know that as you continue on your journey, you, as well as your team, as well as your patients, will continue to flourish. We wish you well, and we want to say thank you for watching this video. Have a great day. Take care.